Hypotension is common during tracheal intubation of critically ill adults and increases the risk of cardiac arrest and death. Whether administering an intravenous fluid bolus to critically ill adults undergoing tracheal intubation prevents severe hypotension, cardiac arrest, or death remains uncertain. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar and today I'm going to talk about the effect of fluid bolus administration on cardiovascular collapse among critically ill patients undergoing tracheal intubation. Among critically ill adults undergoing tracheal intubation, administration of an intravenous fluid bolus compared with no fluid bolus did not significantly decrease the incidence of cardiovascular collapse, according to recent research published in JAMA. Hypotension during tracheal intubation results in part from medication-induced vasodilation and decreased return of venous blood to the heart due to increased intrathoracic pressure from positive pressure ventilation. The intravenous administration of a crystalloid solution might counteract these effects by transiently increasing intravascular volume. Current international guidelines and expert recommendations suggest that critically ill adults undergoing tracheal intubation receive a fluid bolus. A fluid bolus is administered during approximately 40 to 50% of emergency tracheal intubations in current clinical practice. The randomized clinical trial enrolled 1,061 critically ill adults undergoing tracheal intubation with sedation and positive pressure ventilation at 11 intensive care units in the US between 1st February 2019 to May 24, 2021. The date of final follow-up was 21st June 2021. Patients were randomly assigned to receive either a 500 ml intravenous fluid bolus or no fluid bolus. Among 1,067 patients randomized, 1,065 completed the trial and were included in the primary analysis. The cardiovascular collapse occurred in 113 patients in fluid bolus group and in 96 patients in the no fluid bolus group. New or increased receipt of vasopressors occurred in 20.6% of patients in the fluid bolus group compared with 17.6% of patients in the no fluid bolus group, and a systolic blood pressure of less than 65 mm occurred in 3.9 versus 4.2 respectively. Cardiac arrest occurred in 1.7% versus 1.5% and death occurred in 0.7% versus 0.6%. Death prior to day 28 occurred in 218 patients in the fluid bolus group compared with 223 patients in the no fluid bolus group. Thus, the authors concluded that among critically ill adults undergoing tracheal intubation, administration of an intravenous fluid bolus compared with no fluid bolus did not significantly decrease the incidence of cardiovascular collapse. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.